In 2021, AgeWell hosted a series of virtual discussions to hear from you and what you want the future of technology and aging to look like in Canada. AgeWell is Canada's technology and aging network. Our mission is to continue developing our community of over 1,000 researchers and future leaders, more than 420 partners, and close to 5,000 older adults and caregivers. All of us are working together to accelerate the delivery of technology-based solutions that make a meaningful difference in the lives of Canadians. AgeWell was launched in 2015 and has been bridging the research to action gap since, with the support from the federal government's Networks of Centers of Excellence program. As this program winds down, AgeWell is working towards sustaining the technology and aging, or AgeTech sector. Your contributions are helping us map out the future of AgeTech in Canada. In 2020, we scanned the literature for emerging issues and trends in the sector. In 2021, we conducted a thorough consultation with a variety of stakeholders to verify what we found. This is part of the AgeWell way, using partnership and co-creation with older adults and caregivers in all our work. This video is our way of saying thank you and sharing the results of our work this year. In order to reach a wide audience, we held 5 virtual public roadshow events throughout the country, including a Canada-wide event with French translation. We completed 31 individual consultations with groups from a variety of sectors, including industry, government, and community partners. Finally, we conducted a public survey that allowed more detailed individual feedback. The survey collected 454 responses in total. We're excited to report that we consulted with a wide range of audiences that you see here. We heard the most from older adults, who make up 38% of the people we spoke to. Once we looked at the data, 3 themes emerged regarding the future of technology and aging. They are access and equity, opportunity, and technology not as a replacement. Let's dive a little deeper into these themes. For access, 4 different categories were discussed. First, location was identified as a barrier to access. The ability for people to access internet and other technologies was heavily dependent on where they lived. For example, rural versus urban locations and remote and institutionalized locations may have less access to high-speed internet. Second is cost, another barrier to accessing technologies. This includes cost of physical devices, the internet, as well as funding needed to deliver the related programs and initiatives. Often discussions about the location, cost, and affordability overlapped. For example, if people were living in communities where basic needs were not met, then technology was not at the forefront of their minds. Third, usability ties into how individuals physically use technology. At AgeWell, we believe technologies need to be designed with and for older adults. For example, when participants discussed wearable technology, one of the factors that correlated with adoption had to do with their attractive and discreet design. If the technologies couldn't offer that, people were less likely to use them. Finally, digital literacy. Here there was a big focus on not just helping people solve one problem on a device, but helping people learn the skills to navigate the digital world more comfortably. Participants also spoke about wanting personalized one-on-one support when using a new technology or device. Many likened it to having a virtual grandchild that they could turn to for questions whenever they need. Access, of course, ties to equity. The way participants talked about access in these conversations was that sometimes as a society, we are putting the cart before the horse when trying to look at how technology improves the lives of older Canadians. This can lead to challenges if we're not simultaneously addressing equity and access, as we risk leaving a lot of people behind and broadening the digital divide. Ensuring a focus on equitable access is vital as we move forward, because people believe there is incredible opportunity in the AgeTech sector. A direct quote from one of the consultations when we were talking about the future of technology and aging was, "Everywhere you look, there are opportunities." There were 4 categories that were most discussed when participants talked about opportunities for technology and aging. These areas are healthcare and prevention, cultivating connections, aging in place, and wellness. Through an age-well lens, you can read these 4 as our 8 challenge areas: healthcare and health service delivery, staying connected, supportive homes and communities, and healthy lifestyles and wellness. Within each of these areas, there were key insights. Under healthcare, a big focus was on prevention. Technology to facilitate telemedicine and virtual care, as well as remote monitoring sensors and detection devices, were heavily discussed. Another focus was on using technology to help with administrative tasks, to actually free up people to provide more direct in-person care. Within cultivating connections, participants talked about their experiences during COVID-19 and how much technology allowed them to stay connected with their family and friends, but also about connection in terms of connecting people to a community or a group to foster a sense of belonging. Mutually beneficial intergenerational connections were also commonly discussed, especially for digital literacy training. These intergenerational opportunities did not only include connecting teenagers with older adults, but also connecting older adults with startups and other organizations in AgeTech to leverage the skills that older adults have to help enhance and grow this sector. Aging in place was one of the most discussed topics within the consultations, and it encompasses a variety of different technologies that can help people leverage their freedom of choice to decide how and where they would like to age. The possibilities that technologies such as smart homes, artificial intelligence, and robotics create were key parts of this discussion. Another point of focus was on mobility and transportation due to the need to ensure that people have access to transportation in order to age in place. Finally, the area of wellness represents the discussions participants engaged in about using technology for health, but also into the possibilities of how we can help people connect to their personal hobbies and interests, things that create joy in their lives, such as art, music, exercise, lifelong learning, and brain activities. The final theme that came out of the consultations was that technology is a complement, not a replacement. Participants often mentioned a concern that we might lose sight of important things that are vital for well-being, like human touch and in-person interaction. People wanted to ensure that as we move forward towards these incredible opportunities, that we're not ever seeking to use technology to replace these things, but only to complement or enhance. One participant captured people's mindsets about this by saying, "Alexa will never take place of someone coming in and having tea." Some participants worried that if they started using new technologies, they couldn't go back to other methods. For example, some were concerned that if they started emailing their grandchildren, they would no longer be able to call them, and it would limit how they could interact with people and things. Finally, there are people who do not, and will never want to, use technology as a solution, and that is valid. We need to ensure that we're not leaving these people behind as we welcome more technology use in this sector. Results from our consultations demonstrate strong support for the AgeTech sector. Over 85% of participants believe that there is at least above average potential for the private sector in AgeTech. Over 90% believe that it is important or very important for government to invest in AgeTech. And over 75% of participants indicated that they are more willing to learn about using new technologies since the COVID-19 pandemic. The results from our survey are aligned with what we heard during our consultation meetings. The top needs that participants identified for technology and aging were affordable internet access and user-friendly technologies. The biggest barriers are cost and lack of technology designed for and with older adults. The role that respondents believe that AgeWell should play in this sector are to act as a champion for greater adoption of technology in aging, and to test and verify technologies due to the large number of options available. Finally, respondents believe that supportive homes and communities, or aging in place, is where we should focus our efforts as we move forward. These are the top 5 most frequently used words during the consultations, apart from technology: access, people, health, support, and connection. Over the summer, AgeWell will be aligning the results of these consultations with our strategy. We will create a summary of the opportunity for the AgeTech sector and share it with you during our AgeTech Innovation Week happening this October 4th to the 8th. Please save the date and keep in touch with us through our website, email, and social media channels. Thank you.